All right, so I do have a very short amount of time to do quite a deep dive into the evidence from Nova Scotia. And I'll encourage you to ask some questions at the end if I don't cover everything that you're expecting to hear. But I'm going to first of all start this presentation off with a disclosure statement. So I'm going to start this presentation off with a disclosure statement that much of the research I'm going to be presenting on today comes from funding from a variety of sources, federally, provincially, government, and from most recently from the Public Health Agency of Canada and the private sector. And I'm also just going to check in the room. How many of you have not heard of the Uplift Partnership? Just want a show of hands. Okay, so I'm hoping that you all have some understanding of the work that the evidence actually kind of came towards, and the work that we've done through the Uplift Partnership, because I don't have time to go into a great deal of detail about that either. So I'm going to start with the spoiler alert, because as I think you've already heard from Kate's presentation, there is lots and lots of research on the implementation of the health promoting schools model in Nova Scotia and indeed globally that you've already been made familiar with. Yet, despite this evidence base around the health and learning benefits of health promoting schools, we also know that there are some implementation gaps, and we heard that really clearly. I love that expression of like admiring the problem. We've done that to death in this province. We really know that some of those implementation gaps really relate to things like engaging youth in the health promoting schools model. We also know that successful implementation is dependent on leadership and buy-in from within the school system. And this means seeing education and health outcomes as interdependent and amplifying, so that we can't have one without the other. Kate stole my words because she also talked about health promoting schools being an add-in and not an add-on. And that's what the work of the Uplift Partnership has been trying to do, directly informed by the body of knowledge that we have. And you'll hear something more about the impact of the partnership I hope in this afternoon's presentation. I'm looking at Stephanie for reassurance in that.
Just 1 second, I'm going to leave the room. I'll be right back. Nice love.
Okay. So in the remaining time I have, I'll be briefly describing several research projects that I have been involved in, and I'm going to conceptualize this through a gardening metaphor. I'll talk about the foundational studies and events that have happened. They're really kind of the things that I think about as preparing the soil. And one of these is the grassroots movement that actually started in one region of the province that I'm sure many of you are familiar with. But then I'm also going to talk about the Children's Lifestyle and School Performance Study, because that's where my involvement in health promoting schools work came from, and the investments that followed the results of the first round of that data collection. Next, under planting the seeds, I'm going to share the 3 areas of research that really helped us to understand better the value of student engagement in relation to health promotion in schools, and also around school food provision, because that's another area of my research interest. And I'm going to talk about how the health promoting schools model showed up in the Tri-County region of the province through another piece of work that we did. And then finally, harvesting the crop will be talking a little bit more about the work of the Uplift Partnership, which has been instrumental in translating research into practice for the effective and sustained implementation of HPS across the province. And I also want to just reiterate that the Uplift Partnership, actually, it was not research. It's really what we would consider knowledge mobilization or implementation science. As an academic, it's been quite hard for the last 6 years doing this kind of work that actually, there have been some publications, but maybe not as many as I would be expecting from a traditional project. And that's because implementation science, knowledge mobilization work is actually really quite hard, because you do rely on those partnerships to move these things forward. So if you work in health promoting schools in Nova Scotia, I'm sure you're very familiar with this model, and you've already heard part of it, from Kate, and this is from the World Health Organization. But essentially, health promoting schools is an evidence-based, whole school approach to health promotion that emphasizes working together to strengthen the capacity of the school community as a healthy setting for living, learning, and working. It recognizes that time to support health in schools can enhance and not impede academic achievement, and that school health strategies can help students at risk for poorer health and learning outcomes. Again, that equity piece is really important to me. And some of you may also be, as I say, familiar with the grassroots initiative that began in the Annapolis Valley in 1997, well before I had any inkling that I was going to move to Canada. It was really driven by the parents and the teachers and the community who came together to address the health behaviours of students in the region, or to improve the health behaviours of children in the region. The Annapolis Valley Health Promoting Schools program set out to make the healthy choice the easy choice, and I'm going to come back to that shortly. And a few years on, and a few years before I did actually translate my inkling of coming to Canada to action, I began working with a colleague, Dr. Paul Vuglas, who had originally started the project that's called the Children's Lifestyle and School Performance Study. And again, show of hands if you do not or have not heard of this study in the past. Okay. So the class study was a population level survey of health behaviours among grade 5 students that went out into the field in 2003 and had a second round of data collection in 2011. This is a pretty busy slide, so I do apologise for that. But essentially what you see here is data collection, go use my little pointy thing, happening around the age of 10 or 11, so grade 5 students. Census data are used to ensure that the sample that was captured, which is approximately half of the students in the schools at that time, was representative of the rest of the population. The measures included in Class 1 were focused on self-reported diet, physical activity, and mental health status, although I would argue that the diet and physical activity were the more prominent. But also there was measured height and weight. And in Class 2, based on research evidence that was coming out at the time, we added in self-reported measures of body image, food security, and sleep, again mentioned by Kate earlier. Then the survey data, and one of the things that I did when I first came to Nova Scotia was help with some of the survey data linkage. So Paul was very insightful to actually get health card numbers from parents of the children who participated in both rounds of class. And those data were then linked with various other sources of data. So the healthcare utilization data enables us to go back to birth and up to the age of 18 to look at how the health behaviours that were captured at the age of 10 or 11 impacted future healthcare use up until the age of 18, as well as going back to birth through the linkage with the ATLE perinatal database, which every child that's born in the province is logged in that database. So this is a really rich data set that allowed us to learn about the health behaviours of the grade 5 students that were surveyed. We've got quite a few publications. This is probably the main one at the bottom there. And say the slides are available to you, so if anybody wants to follow up with these studies, then please do. So I'm sure that none of you are surprised to learn that many of the children who participated in Class 1 had suboptimal diet and physical activity levels overall. Again, we've heard that that's a global problem. And importantly, children with better diet qualities were also doing better academically. So again, that healthy kids learn better evidence was there. But worryingly, children who bought their lunch at the school had poorer diets than those that went home for lunch. And those two findings actually sparked concern in the Department of Education. Now, one of the other things that the data revealed was a cluster of schools where the health behaviours of students were better than elsewhere. And hopefully you've guessed where that is. Any ideas? Anyone want to shout out? The Valley, yes. The Annapolis Valley Health Promoting Schools model actually showed up in the Class 1 data as an area where students were actually demonstrating healthier behaviours. And then recognising the long-term consequences of this suboptimal health and well-being, the provincial government of the day made quite a few investments in health promotion. So those of you who've been around for a while will remember the school food and nutrition policy came out in about 2006 or 7. There was the funding for the health promoting schools model was actually implemented then. And there were also some things around physical activity as well. And so that sort of set us up into what we would call a natural experiment. So we have like the class 2 data from 2003, which are obviously different children in both of those rounds because, children age out of the school system. We had those investments, and then we were able to go back in 2011 and repeat class 1 in class 2 and see how the health promoting schools investments and the school food and nutrition policy was actually being implemented within the school system. And class did find some improvements in diet quality, most notably for a reduction in sugar-sweetened beverages. And Brian mentioned that earlier, that you remember when pop machines came out of the schools, caused a lot of friction. But actually, we do see that in the data as well, that there are improvements in intakes of those types of drinks because it was a physical change in the environment. We also looked at I've lost my place there. Yeah. Sorry, I've gone forward one. Yeah. We also looked at the implementation of the health promoting schools practices, and there were 64 that we were looking at. So again, this is much broader than just sort of food and physical activity. And what we found is that there was lower implementation of health promoting school of health into the school improvement goals within our schools. That data to support health promotion outcomes were not being collected. Again, that's another really important aspect of knowing if we're actually making an improvement, is to see that in the data. That school policy for HPS had some limitations, yeah, and the opportunities for student leadership were very limited. The policy environment is particularly important here as well, because what we know is an important pillar of the health promoting schools model. And we have seen that the number of policies implemented within schools have increased over time, and in some cases quite dramatically. And I think it's really interesting, again, to sort of look at this from the point of 2004, or 2004-05, where the investments were made. You can sort of see that the pace has gone up. And so these all points to areas where the implementation of HPS could be, it illustrates how the policy environment around health promotion in schools have evolved over time. And that really helps us to understand which policies are accruing, which topics are accruing new policies. And you can see that the focus is often on safety, on inclusion, or academic achievement, versus some of those more traditional health promotion topics that we'd be thinking about. Now, this isn't necessarily a problem, but it does suggest an area of policy action or inaction that may help or hinder the implementation of the health promotion priority schools principles and values. And one other piece of evidence I want to share from the Class 2 study is the identification of another natural experiment in the Tri-County region. And in this region, we found that health promoting schools implementation had been formalized in some schools, but not in others. And those schools were due to be sort of transitioning into HPS schools. But that gave us this window of opportunity to look at, well, what were the HPS schools doing, and what was happening in the other schools. So we secured additional funding for this, and really we wanted to look at working with the region as well. So very much that approach of looking at that context within different school communities, which is so critical to the way that we implement HPS in Nova Scotia. And through this collaborative process, and drawing on a ton of the existing literature, we developed a tool which we called the Health Promoting Schools Ethos Tool, around some of the health promoting schools constructs that we identified as important. And you can see this tool applied to a number of the schools in that region. And I think what's really interesting is to take, you can look at School 1, which has really good implementation of all of those constructs, versus something like School 13. So we were able to sort of see some of that culture showing up, some of that sort of, I always think of it as like a touchy-feely sort of thing. You can walk into a school and feel that culture. but it's really hard to measure. And so that's what we really tried to do. But this was quite a lengthy tool to fill out, too much really for doing on a practice-based project. We have redesigned that through the Uplift Partnership as a much more more of a planning tool, more of a way of identifying where attention should be focused. Now, while all of this work was happening with the class study, I also began collaborating with my colleague, Dr. Camille Hancock-Friesen. She's was a pediatric cardiac surgeon at the IWK who developed a school-based health promotion program called Heart Healthy Kids, or H2K. And that was in an effort to address the damage that she was already seeing manifested in the blood vessels and the hearts of the children that she was operating on. The H2K program was focused primarily on physical activity and was a volunteer-led program, usually made by medical students, because again, that was who the people that Camille had access to. And it happened in the lunchtime period in schools in Halifax. I think we tested this out in 10 schools in Halifax. And we came up with the idea of training students in grades 4 to 6 to deliver the program rather than having to rely on the volunteers. And we secured funding to do this as well. And we looked at the impact of the intervention on physical activity levels using pedometers. And what we saw was increases in physical activity among participating students. But we also saw a range of other benefits amongst the mentors and the mentees. Increases in confidence, increase in leadership skills, all those kind of things, again, that often may not be taught in the classroom. And this further reinforced in my mind the importance of engaging students as change agents in their school community. And then one final piece of evidence that I want to talk about that planted the seeds of the Uplift Partnership arose through a project that assessed the implementation of the school food and nutrition policy. And as part of this work, we talked to students about their experiences with the policy and with school food in general. We learned that students were rarely engaged in decisions at that time, in decisions about school food, but they really wanted to be involved and they had things to contribute. And they produced a range of artistic outputs from drawings to drama. We did photo voice with them. And they shared their thoughts on what mattered to them in a youth-led event that took place in 2018. So I'm coming to the end, Claire. Bringing all of this research together then led to the creation of the Uplift Partnership. And again, this is quite a busy slide. And Uplift is a school, community, university partnership with the goal of catalyzing the implementation of the HPS model through a youth-engaged approach. Again, bringing in all that evidence. I questioned my sanity as to putting in the original proposal to the Public Health Agency of Canada because the money came with strings attached, which is that for every $1 of the Public Health Agency money, we had to have private sector funding. And as you can imagine, in a province like Nova Scotia, raising funds is hard. But we were able to leverage $5 million from the Public Health Agency and $3 million of private sector funding to undertake this work. And the goal was really like, we know all this, let's do it. And let's work together and collectively and collaboratively to bring it into action. Much of the investment from that funding was in the creation of these youth engagement coordinator positions. What we tried to do is have these situated within the regions that we had. We didn't get into every region in the province, sadly. We didn't get the full amount of money. I was actually aiming for 10 million, and that 2 million would have got us into the 2 other regions of the province, Cape Breton and Halifax. But we also provided direct support to schools through the form of $5,000 seed grants that students were able to come up with the ideas for. It's great. We have a youth engagement coordinator in the room if anybody wants to, or an ex-youth engagement coordinator, I should say, one of the first youth engagement coordinators that we hired. And they used that money as a carrot to get into the school and to help the students, but all the way through have told us that it was the process, not the money, that was the important thing. We had an advisory board or an advisory committee that met regularly to sort of guide the direction of the work and had representation from health, education, communities, culture, tourism and heritage and other key partners in this work. And we had working groups that developed, that kind of focus on certain aspects. Kate mentioned the importance of sort of like having a shared understanding. And we spent a lot of time coming up with like, how do we talk about health promoting schools? And we had an evaluation working group, which I'm sure Stephanie would kill me if I didn't talk about that one too, that really guided the work that we did with the evaluation. And the evaluation, we had to have didn't have to have it, but well, we did have to have it. A third-party evaluator came in to do that work, and Stephanie, who's going to present to you later, was that individual who's done a fine job at really kind of nailing jelly to the wall, I think, is in the work that we were doing.
On the wall. Is that what you just
Yeah. You not heard that one before?
that one?
So, to summarize, there is a strong evidence base that underpins a health promoting schools model in Nova Scotia, which I hope is evident across the projects I've outlined. You've heard from Kate about the value and importance of health promoting schools more broadly, and the Uplift partnership was built from this evidence to address the identified implementation gaps. And it's worth noting that the first 3 of the youth engagement coordinators that we hired for Uplift began work in the 2019 academic year. And you all know what happened in March 2020 with a global pandemic closing schools. That kind of put a bit of a spanner in the works, I'll say that. Have you heard that one before? We weathered that pandemic. We saw some of the redeployment of key health promotion people in the system. But this caused us to think differently about the way we work together. And it also shed light actually on the critical importance of protecting the health and well-being of students and staff in schools, both within the pandemic context and beyond. And as we started to wrap up the work of the partnership, we received confirmation in the spring that the YEC positions are going to be, well, have been sustained into permanent positions. And that is just, from a systems change perspective, that is just such an amazing and major milestone. Thank you. It's what we set out to do, but there were many a time I didn't think we were going to get there. And sometimes it's hard to see the impact on the ground, for me at least, what felt like a 30,000-foot view. So I wanted to share this cute photo of the students from the South Shore School. This is probably the photo that sums up my love of this project. It's like my third child too. They have this giant uplift check. We skipped the kids the uplift check because we had donors who needed to be made happy by seeing where their money was going. And it must have been a spirit day because they're all adorably dressed as animals. And this image never fails to make me smile because it really does. The team effort, and it really does take a village. And there are so many people to thank: our funders, our schools, partners, many of you in the room, who believed in what we could achieve together and valued the research that came before. Thank you for your time.